Oh, hello. Welcome to the live stream. I am Jenny Mitich, and we are here in Boca Raton, Florida for the Symposium for Metabolic Health. I'm going to take a sip of my Sprite Zero. Don't judge me. I just had to cram a bunch of pork rinds and a hard-boiled egg down my throat because I was starving. So we're here in Boca for the Symposium for Metabolic Health, Day 2. I am going to go over all of the speakers from today and the things that we learned quickly. And then I'm going to get over to the question section. So if you have any questions about the carnivore diet, any big wins, any difficulties that you're encountering, please let me know in the comments section. And as soon as I'm done recapping Day 2 of the Symposium, I will get to those. First off, if you can hear me, let me know. Seems like I haven't gotten any comments yet saying that you couldn't hear me. So that's a positive. But if you can, just, let me know in the comments before I move on. Let me just show you where I'm at right now. So we are at the Symposium for Metabolic Health in Boca Raton, Florida. These are just a group of the speakers that have been at this wonderful conference. And it has been so good. Day 2 was excellent, and it looks like everybody is ready to go and can hear me. Wonderful. Thank you for letting me know, guys. So that is where I'm at right now with my wonderful husband. He's relaxing right now. I also want to mention before we get started that this live stream is sponsored by ButcherBox. ButcherBox is a premium meat subscription delivery service, delivers high quality grass-fed, grass-finished beef, organic chicken, pork raised crate-free, and wild-caught seafood straight to your front door. So if you head to the link in the description, there is always a really great deal. I'm pretty sure this is the one that's going on right now. Free ribeyes for a year, free chicken breast for a year, or free filet mignons for a year with every box that you end up ordering if you sign up through that link. So give them a shot. They are excellent, and I really enjoy the meats. All right, let's get to it. So, I took copious notes. That was Day 1. Today, we started off the day with Dr. Eric Westman. He's actually one of the board of directors of the SMHP. The whole symposium, he has a big part in it. So he speaks at almost every one of these. I can't remember if he spoke in San Diego, but he did a really great speech. We actually caught the end of it when he was doing the Q&A session. And we love Dr. Westman. He is very moderate. He's been in the game for a long time and, has a practice, works at Duke, and he's really big into everything being evidence-based. So because he teaches, so he's excellent, and I always love hearing him speak, so that was great. The next speaker, it was really, really interesting. This was Gurpreet Pada, Dr. Pada. Excellent speech. So he talked a lot about costs and incentives. Every company, every industry, there's a cost, and then there's incentive, why they do things. So medicine in and of itself, taking a medication is not bad, but you need to understand, why, pharmaceutical companies are doing what they do. And then he dove into GLP-1s and talked a bit about their dangers and their positives, talking about how GLP-1s are meant to be adjunctive. So you need to take care of the lifestyle first and then add on the GLP-1s. Talked a bit about how they reduce stomach acid drastically from that of our normal stomach acid is 1.9. They can reduce it to a 7. And that does still occur with microdosing. It has the same effect. It can have desensitization of receptors, the GLP-1 receptors, it's so hard to say that word, desensitization of the receptors over time, so that you'll need more and more in order to have a similar-ish effect. You see that with most drugs. There can also be an increase in depression, anxiety, suicidal thoughts, and then, of course, a regain of fat when you're no longer taking it, and majority of the remaining weight loss is bone and muscle. It's not to say that GLP-1s are bad in all cases. They definitely have a place. And when they're used with a clinician that knows what they're doing, they can be amazing. And I agree with that. But there are some issues out there. So that was really interesting. And then he touched on the vagus nerve and how stimulating the vagus nerve can like reduce your A1C by like 2 points. It was crazy. Using the ear, it prevents desensitization of those receptors, and it is covered by insurance. So he's working with a patient population that is low income and does have some insurance, but it's not like super high quality. So he has to figure out ways that he can address these people's health issues because the people that he is working with are very sick and low income. So he has to come up with creative ways and creative solutions to help this patient population. And it was just a very fascinating talk. After his speech, Dr. Ben came on and he did a whole lecture on exercise. So if you've seen Dr. Ben, you'll know that he always does exercise stuff. He's a great guy. We actually had to dip out for that one. So we ended up going to the gym. There is a Lifetime Fitness down here in Boca that we went to last year. So we did that again, trying to just kind of keep up with the fitness when you're driving a lot and, we're traveling right now. So that was good. I did a strength training, legs. I did sauna for 15 minutes and I did a Stairmaster. So that was fun. And then we made it back for Dr. I'm not going to say his right, Cucazella's speech. And he also talked about GLP-1s. So for him, he did the ethics of using GLP-1. He talked a lot about the history, and I didn't realize that it was first kind of discovered around 2005. I guess maybe that was the first published paper on it. But the Gila monster venom was kind of how scientists came to discover GLP-1s in the first place. Daniel Drucker discovered that, the GLP-1 peptide. And so I'm going to go in and kind of read that a little bit more. But then he talked about the potential benefits, the potential harms. It was a very nuanced look at it. I couldn't, see either way, if he's for or against. I think he is for. He has used them in his practice with maybe 10, 15 patients. But, each patient is an individual and each case needs to be looked at individually, right? So that makes a lot of sense. And some of the ways that you can mitigate some of the negative effects of a GLP-1 would be like minimal effective dose. Make sure you're really doing as low as possible. Keeping up with strength training and protein. There's a click dosage method. So each of those pens has like clicks in it. You can really kind of spread out the dosing that way, saving money. Making sure you're eating a nutrient-dense, low carbohydrate diet. Perhaps having better rules and regulations around the prescribing of these substances because they are very powerful and it's kind of the Wild West out there right now. And working really to restore metabolic health as being the end point. And how a proper human diet can do all of the same things for most people, but there are some people that need a little boost. So interesting stuff. I personally, I'm not a doctor, so I can't say anything to that. I think my opinion is I think GLP-1s have a place. I think they're way overprescribed, but I think they do have a place for some populations for sure. But yeah, again, I'm not a doctor. So my opinion doesn't really matter that much. All right, so the next speaker was Lily Johnston. She's a vascular surgeon, and she's actually the daughter, I'm pretty sure the daughter of the speaker on the first day, Barbara Levy. So excellent talk. Basically, women are not small men. We have completely different, we're just completely different. Our bodies are different, our anatomy is different, our physiology is different. And she then talked about CVD, cardiovascular disease, and how it is the leading cause of death for women, even above cancer. And for women, it presents differently than men, right? So the complications are different, the risks are different. And for women with myocardial infarction and stroke, like 64% of those women had no prior symptoms. So it's really hard. And she had a really cool slide that for every red dress is kind of the symbol of cardiovascular disease in women. There's 100 pink ribbons because, breast cancer is kind of what's focused on for women, but cardiovascular disease is actually more of a risk. Interesting stuff. Talked about reducing risk as much as possible, and like the residual risk that's left over after you either put somebody on medication or do some sort of intervention, but you always have some risk left over, right? You can't get risk to zero. So what can you do? Addressing insulin resistance and inflammation, of course, working on disordered sleep. Sleep is something that I think we all take for granted, and it's so vitally important for our metabolic health. So addressing that. Talking about scans. She likes CACs, but she prefers CCTAs and or a CIMT if it's read by the correct provider. They're notoriously inaccurate if done incorrectly. So you really have to have somebody that knows what they're doing. And then the final residual risk to take care of is genetics. So yeah, that was really interesting talk. Liked that one a lot. And then the final of the day was Dr. Tro and Laura Buchanan. Laura went through a kind of like an imaginary case study of a little boy named James, 8 years old, who has sudden onset of type 1 diabetes. So she took us through the entire, like the conventional guidelines for type 1 diabetes and how ineffective those are, like eating like 250 grams of carbs per day and then just, using insulin to take advantage of those, and just how dangerous that can be. And kind of a roller coaster, not just for kids, but for anybody with type 1. And then walked us through how a therapeutic carbohydrate reduction diet was able to drop the A1C, normalize glucose levels, and reduce the amount of insulin that this, hypothetical child had to take. Of course, this hypothetical child is based on, actual research and things like that. And then Dr. Tro came in, and he's one of the lead authors on the SMHP's type 1 diabetes nutritional guide position statement is what I should say. Their position statement on using therapeutic carbohydrate reduction in the treatment and management of type 1 diabetes. This came out, in 2024. I remember getting the email about it. It's just a kind of a consensus statement from this group that talks about using low carb interventions to deal with type 1. And it can basically, become a standard of practice. So Dr. Tro took us through the entire process of how they came to a consensus. And it was like a 2-year process. So awesome. Lots of really notable names on that board, on the committees and all that kind of stuff. So man, it was so good. I'm actually going to do a video on that position statement and talk about how effective low carb diets are for the management of type 1 diabetes, because I don't think it's something that's talked about enough. We all know that for type 2, of course, it's, but for type 1, I don't think it gets talked about enough. So definitely going to be doing that. And that was the end of day 2. So tomorrow is the final day, and lots of excellent speakers on the docket. Let me see if I have my app still up. No, it logged me out. So I know Dr. Saiwas is going to be speaking. I know, let's see. There's going to be a panel at the end of the day. I'm just trying to get signed into this app again. With Dr. Boz and a few of the speakers from today. Let's see. Day 3, what is in store for us? Okay, so Matt Calkins is going to talk about the evidence for low carbohydrate diets for children with metabolic disease. Dr. Saiwas is going to be talking about screening and cardiovascular disease prevention in a low carb setting. Dominic D'Agostino is going to be talking about ketone metabolic therapy for brain cancer, the science to application. And then Dr. Ovadia is going to be speaking for about an hour and a half, hour 15, Stay Off My Operating Table, a collaborative approach to metabolic healing. And then the final panel of the day is going to be Barbara Levy, Lily Johnston, Dr. Boz, Dr. Wafa Abdel Hadi, Dr. Saiwas, and Dominic D'Agostino. So that is that. And I will not be doing a live stream tomorrow night because we are going to be driving back over to the Sarasota area to get home. So no live stream tomorrow night. But that is what's going on. The next one of these conferences is going to be in San Diego, and I believe August. So this happens twice a year, once in Boca, once in San Diego. Completely 100% open to the public. Lots and lots of doctors and researchers presenting really high level stuff. And if this is something that you really enjoy, like I do, I learned so much. I'm not a doctor, but I'm passionate about this topic, and I always learn something at these conventions, these conferences. So if you want to go to the next one, I think tickets for that one are already on sale. I think I already have a link in the description of this live stream where you can get over to Low Carb USA's website. It's San Diego 2025. I will be there, and it's going to be so much fun. So I hope that you guys can come. All right, guys. That's it for my updates, I think. Oh, I did want to say, get your questions into the question area so I can talk about that. I did want to let you know that in 2 weeks, I'm going to be speaking at the Collaborative Science Conference in Vegas. This is Dave Feldman's conference. And you can see in this graphic tons of big names: Dr. Nadir Ali, Chris McCaskill, David Diamond, Adrian Sotomoda, Nick Norwitz, Dr. Ben is there, Brett Shear from Metabolic Mind, Eric Westman, Dr. Ken Berry, Dr. Jamie Seaman, Nina Tay-Schultz from The Big Fat Surprise, like tons, Amber O'Hearn, like there's like so many big names going to be at that. And then little old me, I'm going to be talking about when carnivore isn't enough, overcoming stubborn insulin resistance. I've done public speaking before. I used to have a job where I did a lot of it, but this is going to be the first time that I'm speaking in front of, a lot of people that I really respect and have learned a lot from. So I'm a bit nervous, but I think it's going to be so much fun, and I would love for you to be there. You can head over. I put the link in the description. And the cool thing about this one is your ticket, whatever you pay, that is a donation to the Lean Mass Hyperresponder study, the second one. So you can pay as little as $25 for the entire weekend to come to this conference, this COSI conference. Vegas, February 8th and 9th. So much fun. All right, let's get over to all questions. Hello, Virginia. How are you doing? All right, here is a question. Marilda. Jenny, it was mentioned one waits 12 to 14 hours of fasting before getting blood work done. What happens if one waits longer than 14 hours? It can skew your results. I think it's just standard practice for 12 to 14 hours, which really isn't that hard to do in theory. I mean, if I eat at 6 p.m. and then I get blood work at 8, good to go. If it's 15 or 16 hours, it's not going to be that big of a deal. But we have in the past, my husband does really long water fasts. And we did one where we went and got blood work for him after, what was that, a 10 to 14 day water fast. And his numbers were all sorts of out of whack. So I think just, take it with a grain. If it's 15 hours, you're going to be okay. But in that video, I do the general advice of 12 to 14 because, that's what most people need to do. Smooth Moves. Hello. Love to discuss coaching. I wrote you on Instagram too. Great. It's been a really busy weekend, so I will get to my Instagrams. I'm getting to them slowly but surely, but yes. I don't know if you want to do coaching with me or if you want to discuss something else, but yeah, we can totally talk about that. Virginia, everyone's saying they can hear me. Wonderful. All right, Carnivore Police in California. Hello, welcome. Charlotte, curious about coaching as well. So if you guys go over to my Instagram or my TikTok and you go to my bio and go to my link tree, click on that. And at the very top, I don't know if you can see now, it's too bright. It's not going to show it, I don't think. This very top one, it says coaching. I don't know if you can see that. You can click on that and you can book coaching dates with me. Now, right now, I don't have anything available in January. I am going to open up a couple of dates for the 27th, 28th, and 31st, and then I'll start scheduling into February. With this conference and stuff, I've been so busy. So I will definitely be opening up some dates there, but that is available. World, hello, you're in California too. Thank you so much. I appreciate it. All right, Tracy, been carnivore for a year and a half, and I wish I had gotten an air fryer in the beginning. Game changer. I bought the Tasty, but then gave that to my mom and got the Ninja double air fryer. Nice. Yeah, we got an air fryer, I don't know, like a year into our carnivore journey. We started with the Power XL, and then Tasty sent me an air fryer to test before I accepted them as a sponsor, and we loved it. And we never look back. I love the Tasty just because it has that temp probe, and we're always cooking steaks and chicken and pork chops and stuff, and it just makes it so easy. Honestly, I love an air fryer. I think it's a must-have for the carnivore diet. Debbie Price, hey girl. Oh, hey, how are you? Good to see you. Christine, heart attack symptoms are different in women than men. Women are often misdiagnosed. Yes, and that was one of the things that Lisa Johnston talked about. Most of the time there's some kind of chest pain for both men and women, but a lot of the time for women, there's like nausea. What was some of them? Nausea, stomach distress, fatigue, things that we all kind of get gaslit on, like, oh, you're just tired or whatever. Plus, there's another thing with women is, we're kind of natural caretakers. Like, we take care of everybody else's needs before our own. So we could be like, oh, I've got chest pain, and oh, I don't feel good. But like, I got to go pick up the kids. I got to go get groceries. I got to go do that. And maybe if I'm still feeling like that, I'll go get it checked out. So like the delay in treatment, diagnosis and treatment is much longer for women. So like men, it was an average of 15.6 hours. And for women, it was like 2 days. Craziness, so yeah, that is definitely true. Is there an easier way to clean an air fryer? The cleanup is what stops me from using mine. So I have the Tasty. It has, I have the model that's a ceramic coating. They're going to be releasing that model very soon. So I just wipe mine out with a paper towel. I know Steak and Butter Gal, she puts it directly into the dishwasher. I mean, wipe it out. You don't want all that grease in there, but, wipe it out and then put it into the dishwasher and just do it that way. Seems to work. I have never put mine in the dishwasher. I just kind of wipe it out and then clean the little insert, the little tray thing. But yeah, easy peasy. Christine, it seems to me that all type 1 diabetics should be on a keto diet. Kind of a no-brainer. True, a no-brainer to us because we know, right? But when you are diagnosed with type 1, typically, especially with like kids, it's like a ketoacidosis situation, and they kind of like are rushed to the hospital and then hooked up. And then the parents are educated for an hour or less on what they need to do. And they're given guidelines from the American Diabetes Association, which recommends like 240 grams of carbs per day for children 4 to 8. And then they're like, oh yeah, if you eat more carbs, just, use more insulin. It's not that easy. It's very complicated. And chasing carbs with more insulin can also lead to double diabetes, where you're type 1, but you're also type 2 in that you're insulin resistant because you've used so much insulin. It can happen. It's just so much easier to use a low carb diet to manage type 1. Type 1 Grit is an excellent Facebook group. Using Dr. Bernstein's method. He is a type 1 diabetic. He's 90, still practicing, and he is like 30 grams of carbs per day or less and thriving. You can have a normal A1C even being type 1 diabetic using an ultra low carb diet. 100% possible. Very, very cool. Brad, my uncle is type 1 trying out the carnivore diet. Great. That's wonderful. Brad, what I'm going to do is in the description of this video, I'm going to add the SMHP's position statement on type 1 diabetes because they have a lot of really good tips on how to manage type 1 using a low carb diet. And he would really get a lot out of that. So I'll put a link to that when I get off of the live stream. Let me put SMHP because it's a really good read. And anyone out there that knows anybody with type 1 or a doctor that's dealing with type 1 patients or a loved one, whatever, get them this statement because it really could be a game changer for them. And very easy to understand. That's one of the beautiful things about the SMHP is they really focus on making it easy to understand, evidence-based, with solutions, with actual things that you can do, which is great. Sherry, love and light from California. Hello, lots of California friends today. I love it. Love it. Yes, that is awesome, Brad. Really, really, really good. All right, Adrian, my love. Hello, girl. I love you. I haven't talked to you in so long. Are you traveling right now? I feel like you are. All right, Virginia, maybe someone may not know those cardio tests by the letters. Yeah, so a CAC is a coronary calcium score, basically. A CAC is very cheap in most cases. I paid $50 for mine, and it checks for coronary calcified coronary plaques. Typically, those don't happen until later decades. But they're easy to get. So if you can get a CAC after the age of 40, good to get one as a baseline. The CIMT, I don't know what that stands for offhand. The CCTA, I don't know what that stands for either. It's not really important what they stand for, just that they're heart scans. So basically the CIMT and the CCTA deal with soft plaques. I don't know what that is offhand, medical abbreviation. All right, CCTA, coronary computed tomography angiogram. It's like a coronary angiogram. It can show soft and calcified plaques. And the CIMT is a little bit different. And like I said, the woman that was talking about it, I can't spell and talk at the same time. Oh my God. CIMT stands for constraint-induced movement. No, that's not it. Carotid intima media thickness test. That's what CIMT stands for. That one also can show soft plaques. So yeah. Jeff. Hi, Jenny. Look forward to seeing you at Meatstock 2025 in May. Oh my gosh. I'm so excited for Meatstock. I don't know if there's any tickets left to Meatstock. It's like sold out. So it's a whole weekend retreat. Like every carnivore influencer is going to be there. I'm excited because I'm going to meet some people that I've never met before. It's going to be so much fun. I don't know if I have. Let me check in my stuff. I need to I'll upload a picture of that. It's amazing, but they might still have a few tickets left. And yes, I will be there. The organizer was just telling me about some fun things that he wanted me to be a part of. And I'm like, yes, it's going to be so much fun. Very exciting. Very, very exciting. Okay, excellent question. I'm so confused, frustrated. 53, going through perimenopause. My family says my high cholesterol is going to kill me. LDL clogged my arteries. I need advice, please. No, that's not how it works. Common misconception, though. So totally valid question. When you're looking at a lipid, okay, also, let me just tell you, I'm not a doctor, so don't take this as personal medical advice. This is just from talking to, researchers in the low-carb carnivore space, going through tons and tons of blood work, reading a lot. So I'll give you some resources that you can take a look at so that you can do some research for yourself. When looking at a lipid panel, you're going to see LDL, HDL, triglycerides, and total cholesterol. Within the context of a low-carb diet, you're going to have some differing levels, right? Because the reference range is based on a population of people that's eating a shit ton of carbs, a ton. Like the standard American diet is what most of these people are eating. It's mostly carbs, like 60%. So their numbers are going to be a little bit different. Also, remember that the LDL, the high, if you're high, that number has been going down and down and down ever since statins have been available, because then they can prescribe statins to more people. So if you understand something about the reference ranges, that's one thing. When I look at a lipid panel, what I'm looking for is triglycerides first. And within the context, usually 150 or less is what you're aiming for. But if you're on a low carb diet, a carnivore diet, you want that to be under 100. That does take a little bit of time to change. And you can see some rises in your triglycerides as you're losing weight. Temporary. The next thing I look at is HDL. In general, you want that to be above 40 for men, above 50 for women, but above 50 is what most people are aiming for. And then you can do the triglyceride to HDL ratio. You want that to be a 2 or less. That's all I look at on a lipid panel. But if you're concerned about LDL cholesterol, being elevated. That can happen for some people. When you go on carnivore, it's not guaranteed that's going to happen. Some people, it stays exactly the same. Some people, it goes down. And some people, it goes up a little bit. And for some people, it goes up way high. And those people are, if they have a few other criteria, boxes checked, those people would be called lean mass hyperresponders. You have to have an LDL cholesterol above 200, while at the same time having triglycerides below 80 and HDL above 80. So they have this trifecta. Also, all of their other markers tend to be really good. Very low hsCRP, which is a systemic inflammation marker. Low A1Cs. Their fasting insulin is low and good. Their fasting glucose is very healthy. They typically are very lean and active. And things like that. So when I'm looking at a lipid panel, I don't just look at just that. Yes, I look at triglycerides and HDL first, but then I want to know what's your fasting insulin? What's your A1C? What's your fasting glucose? And then from there, what's your vitamin D? What's your hsCRP? And what's your GGT? I think those are all, in my latest video I did about basic blood tests. These are very inexpensive tests that you can get. You can order them on your own in 44 out of 50 states in the United States, or you can have your doctor order them for you. They really shouldn't blink an eye at any of those. When you have all those together, you can get a really good idea of what your true, metabolic health is. So yeah, in some cases, people with like familial hypercholesterolemia, having super high LDL cholesterol, not good, right? David Diamond's work has found that it's more related to fibrinogen levels, not the LDL cholesterol. So most of that is just fear mongering. I would focus more on reducing insulin resistance, making sure that your fasting glucose is 95 or less, making sure your fasting insulin is between 2 and 6. A1C, 5.2 or less, I think is the gold standard, but you want to be under a 5.7. This is a lot of numbers that I'm throwing at you, so you can find all of this information in my latest carnivore blood work video where I talk about optimal ranges, what tests to get. I have all that information laid out in there. So that's really good. Another book that you could read is called The Clot Thickens by Dr. Malcolm Kendrick. That one is an excellent discussion about what actually causes plaquing. And it's not just LDL cholesterol. LDL cholesterol doesn't just come in and clog your arteries all willy-nilly. There has to be damage first. And also plaques are not just made up of LDL cholesterol. They're made up of blood clots, calcium, foam cells, so many things. And if there's no damage to your arteries in the first place, there won't be any plaquing, except for very few people with a genetic abnormality. So that was a lot, sorry. But go to my carnivore blood work playlist. I have tons of information about this, and get that book from Dr. Malcolm Kendrick. Very, very good. I air fry my wings, so. And if you're frying your food in animal fats, it's okay. That's good for you. Sherry, have you already done your carnivore bar experiment? Sounds so fun. I did, and I have already filmed the video, and I need to edit it, and then it'll be ready to go. I think that's going to be out the 1st or 2nd week of February, so very soon. All right, Jeff, carnivore cured my metabolic syndrome, also lost 30 pounds. I reached my ideal weight, 50 years old, never healthier, carnivore for the win. That's awesome, Jeff. Thank you for sharing that. I think it's really, really good to share our big wins, right? All right, all of those are good. She's referring to the blood test. Great. Well, then in that case, I wouldn't worry too much about it, in my personal opinion. Hello, hello. All right, Christine, I've always had super high LDL, even when I was vegan over 20 years ago. Never taken statins. Yeah, Nick Norwitz has done some fun experiments. Dave Feldman has done some fun experiments with different food intakes, and yeah, they saw rises in their LDL cholesterol on a vegan diet. It's an interesting topic, and that's one of the reasons why this lean mass hyperresponder study is so important, because will high LDL levels sustained over time when all your other biomarkers are good, will that lead to an increase in plaquing? That's what this lean mass hyperresponder study that is being funded by COSI, the second lean mass hyperresponder study, that's what this is all about. And the first study has shown preliminary data that no, it does not. Plaquing does not increase in these lean mass hyperresponders. So interesting stuff. Interesting stuff. All right, guys, it looks like we're down to the bottom of our questions, and we actually need to get back to that hotel so that we can eat some free low-carb dinner. cool thing about the symposium, when you're here in Boca, they include the low carb dinners with your ticket price. They're an additional cost at the San Diego one. So yeah, thank you. I feel relief now. You're awesome. You're very welcome. You know, it's very common, and you're going to hear that. A lot of people hear that from our families. And what do we expect? We've been told that for the past, 50 or 60 years. The Big Fat Surprise by Nina Schultz is an excellent read. The Great Plant-Based Con by Jane Buxton, I think. Excellent book. And Dr. Malcolm Kendrick, The Clot Thickens, are all excellent books that you can read that really evidence-based and really kind of tear the veil off of all the crap that we've been told for a long, long time. So excellent, excellent books. Okay, guys, I'm going to go because I'm hungry. I'm going to have a whole plate of meat. So we're going to do a regular live stream next week. I don't know when yet, though, because we're traveling. I'll figure it out. But we're going to do our regular live streams again. So this was awesome. I love talking to all you guys. Good to see you. And I will see you again very, very soon. Have a good one.